became governor, I found that healthcare became much more expensive, became a bit more difficult to provide, and I saw a shift of healthcare workers away from rural areas to the urban areas. All nurses wanted to be employed in general hospitals, and all the doctors wanted to work in the big cities. So the rural communities and the rural dwellers and the poor people did not have access to quality health care.
When His Excellency Senator Leo Moke took over as a governor, he asked us to partner with the primary health care program. And we readily agreed, and he sent a team to study the program in Kaduna State. And then following that, we made a blueprint for implementing the program in Cross River State.
In the years before 2009, we had an unacceptable high indices of maternal mortality, infant mortality, and mortality of our children under the age of 5. And there was a need for us to do something. And during the health summits that we had, Tosi Chairai was one of the partners that we invited to come and present to us. And we saw their presentation, we liked their model, and we decided to adopt them and get them to partner with us to see how we could improve on very bad indices of maternal mortality.
Armed with the knowledge that government alone cannot effectively deliver the much-needed healthcare services, Governor Imoke opted for the public-private partnership option in order to ensure that the needed technical know-how, expertise, and equipment were deployed in the quest for a better and healthier Cross River State. To set the ball rolling, a Memorandum of Understanding MOU was signed between the state government and Tulsi Shanrai Foundation. The objectives of the Imoke government at the time of the MOU signing were to make quality healthcare services available and accessible to 90% of the population, to make available essential drugs to the people at affordable cost with reduction in the stock-out rate to less than 10%. To establish a goal-oriented health data management in 90% of health facilities for the focus indicators, and to establish a system to ensure accountability at all levels. The choice of Tulsi Shanrai Foundation was indeed not far-fetched, as the foundation was already in the state offering free eye surgeries and other solutions to eye-related problems, with successes recorded in that area. The development saw an influx of eye patients from neighboring states into the state to access eye care courtesy of Tulsi Shanrai Foundation. Having proved a worthy and reliable partner in health, as its slogan goes, the Imoke's government found in Tulsi Shanrai Foundation a dependable ally to implement the state's blueprint for primary healthcare program, which it developed in 2009.
I invited Tulsi Shanrai Foundation to work with us on primary healthcare personally. I did that not just because of the eye care program, which has been so successful, but also because of the fact that they're implementing a program in a couple of local governments in this country that have become models. And I asked them to take it beyond one or two local governments. I wanted it to be a statewide initiative. And they said to me, well, this is a tough one, but we'll go back and we'll get back to you. And they did go back, and they came back and said, well, we've spoken with our management, and they are willing to support the effort. So the MOU that is being signed today is a culmination of that effort. And it is an MOU that is going to be the beginning of the implementation of what we would call a grassroots program.
In its bid to expand the healthcare services to rural dwellers and hard-to-reach communities, Department of Community Health and Primary Health Care was designated as the coordinating agency for the strategic project.
Tulsi Chandrai Foundation was formed almost 25 years back in Nigeria. We came to Cross River about 11 years back. Now, the idea was to set up sustainable models in healthcare in Calabar, which we can replicate all over Nigeria. About 5 years back, an MOU was signed where the Cross River State Government were kind enough to permit us and partner us in going into every local government in Cross River State. There are 18 local governments in Cross River State, and we started entering each local government, building clinics, health facilities, and now over 18 local governments, there are approximately 900 healthcare facilities. But today our clinics are about 15 to 20 minute walk from every citizen of the Cross River State. High quality care for mother, child and elderly people are being provided. I'd like to thank ever so much the Cross River State Government, most of all the Governor for all the help he's given us. And by the grace of God, if we can make this a working model in Cross River, we can spread it to every state of Nigeria.
The mandate given to TCF with regards to provision of PHC services at the grassroots level had specific focus on Millennium Development Goals 4, 5 and 6, namely to reduce child mortality rate, improve maternal health, as well as combat HIV/AIDS, malaria and other diseases in that order. Another expectation from TCF is to establish operation, evaluation and internalization of the working strategies and project activities with the existing system of Cross River State Government. Baseline survey for health indicators has been done in the local government areas to know the status of health indicators before the start of the program, so that the impact can be monitored progressively and measured at the end of the program in 18 local government areas. Government of Cross River State set targets to reach by the year 2015 to achieve an infant mortality rate of 25 per 1,000 live births, under 5 mortality rate of 10 per 1,000 live births, maternal mortality rate of 136 per 100,000 live births, antenatal coverage of 95% and skilled birth attendance by hospital, PHCs, health workers of 95%, others are 1-year child full immunized up to measles vaccine. Community participation is engendered by having the communities donate buildings for health posts. In 2009, there were 602 health facilities across the 18 local government area of the state, each facility covering an average population of 5,862, a burden that most of the facilities could hardly manage. 411 communities donated buildings with basic furniture for the health center and residents of health workers. This has created a sense of community ownership for the program. As a result, the number of health facilities had increased to 1,013, thereby reducing the catchment area population for each facility to 3,483. This has created an easy access to PHC facilities. The trekking distance to the nearest health facility was drastically reduced as mothers could access a facility within a 30-minute trek. Government provided the basic equipment, instrument to all these newly created health facilities. His Excellency lifted the embargo for the employment of health staff to meet the increasing demand due to the establishment of additional health facilities. 290 nurses and midwives, 920 community health extension workers, 126 pharmacy technicians, 126 laboratory technicians, and 36 drivers were appointed by Local Government Service Commission. Doctors have been appointed by Tulsi Chandrai Foundation on contract basis. In terms of quality care, The skills of the doctors and health workers were upgraded by training and capacity building. 1,882 community health extension workers had their capacity built and their skills in midwifery upgraded. The funds from Nigeria Governor's Immunization Leadership Challenge Award was used to train 276 midwives and 14 doctors in emergency obstetric care, the use of non-pneumatic anti-shock garment for postpartum hemorrhage. Using the same fund, 1,200 traditional birth attendants were trained in home-based midwifery skills and referrals. They have been provided with delivery kits. Doctors undergo periodic short-term refresher training at the University of Calabar Teaching Hospital. Free Health Services Project Hope has been rolled out to all the communities in line with establishment of additional health facilities. Free drugs are provided to vulnerable group of pregnant women and under 5 children. Beneficiary registration, treatment of beneficiaries and data collection, and coordinated by Tulsi Shanrai Foundation. Drug supply chain management is crucial in maintaining uninterrupted services to the people, especially free drugs to pregnant women and under 5 children. This has been achieved by managing the procurement and supply by Central Drug Revolving Fund DRF Committee and LGA DRF committees coordinated by Tulsi Shanrai Foundation. Ambulances and pickups have been supplied to the LGAs for the visit of doctors to the communities and for referral of emergencies. 182 motorcycles have been provided to the ward community health officers and pharmacists for monitoring and supervision. Generators have been provided to ward primary health centers. In cases where healthcare providers at the bottom level encounter hitches in the course of their duties, a strong referral linkage has been built from traditional birth attendants to health posts, ward primary health centers up to comprehensive health centers, general hospitals and the Calabar University Teaching Hospital. Referral system has been strengthened by creating 18 basic emergency obstetric neonatal care center in 18 comprehensive health centers and 11 comprehensive emergency obstetric neonatal care center in 11 general hospitals. Ambulance services are free for pregnant women, deliveries and emergencies of under 5 children. General hospitals provide free cesarean operation. Factored in the structure of the comprehensive PHC program as anchored by TCF was the rollout of other health programs like the HIV PMTCT, of which a detailed work has been developed in collaboration with some international donor agencies. Adequate publicity has always been generated in the course of the project under 8 themes as a way of bringing the program closer to the people via radio, television commercials, discussion programs, as well as billboard in 6 designs across the 18 local government areas of the state.
I dey benefit from this health center where they here so for Abuchiche. I be belle woman as you see. They come clinic here and they don't tell us say everything government don't provide for us free, and I dey benefit from the thing as I can't register. I never pay any money, and very soon I go deliver, and I hope say my pikin too go benefit from that free health when government don't give us so.
Come Rose audition, mbere chief audition. Nimbene mokpang aha family community kena ko no kwari jam o sofa eko moto erare eko saklis erare inpe labaru kwebi ne mintene ani yakena mbe ko beberu mebuani ashibuto kuna le memero the first person in bridge ashibuto kuna inje kosha na chai nere na gba ashibuto kuna na hari ne kuna because heni koware moto go meme na cha tan so ja kwete taja kai moto taba jare ma ashibuto na ashibuto kuna re ne nere ko shabu ko sobucho ye wonyere ri pai ne minere anere na ne minere ya haritam ani ashibuto kuna akwabe ni jam akwabe no ban akwabe ni atita.
We have been carrying out ANC registrations here, deliveries, caring for children from 0 to 5 years free, pregnant women free. And any case that is above us in the health center here, we refer out. and no bad report has been sent back. They have been having their babies alive. Example are some of them sitting around me here.
As a way of internalizing the project, the State House of Assembly had in March 2010 passed the Primary Healthcare Law, while the governor assented to it in May of that same year. The Act makes provision for the establishment of the PHC agency to oversee the activities of the health system in the state and other matters related therewith. This will also ensure long-term sustainability of the project. In all, it is crystal clear that 5 years down the line, when the government of Cross River State, led by Senator Lielimoke, signed the MOU with TCF for the execution of the blueprints for the PHC program, Cross River State is now better and boasts of one of the most effective designed and implemented PHC programs across Nigeria.
Projects like this always invariably run into challenges. But for us, I think that every challenge was an opportunity. And what we did was we translated all those challenges to opportunities. And I think that the Cross River people are much better off today in terms of healthcare delivery, in terms of water supply, and indeed, even in terms of vision.